Welcome to the PHABcast by the Black Women's Health Imperative on Our Own Terms initiative, where we are preventing HIV among Black women and men. My name is Kenyette Barnes. I have an expertise in HIV and interest. I've worked as a lobbyist, I've worked as an advocate around HIV and human trafficking issues, and I am pleased to be here today with you all who are the experts and tell us a little bit about why you're here and who you are.
Hi, my name is Timothy Webb, and I work with the AIDS Healthcare Foundation in Ada, Atlanta, and I also work at Sister Love as one of the board of directors.
Awesome. My name is Brittany Williams. I'm a co-founder of #SightAsister, which is a Black women's empowerment organization where we do some advocacy around HIV and AIDS. I'm also a PrEP user and PrEP proponent.
I am Dr. Keri Norris. I'm an author, advocate, and I'm also the Chief of Health Policy and Administration at the Fulton Dekalb Hospital Authority.
Awesome, awesome. Well, welcome to this conversation. We are honored to have you guys. So we're going to kind of just jump right into it, if that's okay with everyone. So, Dr. Norris, give us a snapshot about what does HIV look like. We hear a lot about it in the news. We hear a lot about it in our social media, and sometimes what we hear is not always accurate, but it's kind of inflammatory.
That's
so
true.
Give us a snapshot. What does HIV look like?
So overall in the United States, about 1.1 million persons are HIV positive. Mm-hmm. Of that population, African Americans as a whole make up about 14% of the population of all U.S. citizens, but make up 44% of all positive HIV cases. So that gives you kind of an insight of how large the number of cases are in our particular community. And when we look at modes of transmission and how people actually contract HIV, then when we look at Black males, 80% of their contractions come from men having sex with men, 14% from heterosexual sex, and then the smaller percentages come from blood transfusions and also injection drug use as well.
What about mother to baby? I remember many, many years ago where we would hear that a lot of babies were getting it from their moms, either at birth or during pregnancy or breastfeeding. What are those rates look like?
So those rates have decreased sharply over time as women become pregnant and then they get tested for HIV. They're able to get them on the necessary drug regimen that helps them to not be able to pass it to their children. So those rates have sharply decreased. They're not non-existent, but it's one of the lesser modes of transmission. And when we think about women with HIV, then 91% of their transmission mode actually comes from heterosexual sex, and the other smaller percentages come from injection drug use, blood transfusions, things of that nature. Okay. So that gives us an overall overview, but about 1 in 7 persons in the Black community don't know that they actually have HIV.
So that's different from are HIV positive. These are individuals who don't know their status.
Exactly. And so when we look at our positive numbers, we still don't have the true picture.
Wow.
Because we have, unfortunately, quite a few people who are walking around who won't get tested for various reasons.
And I think that's interesting to know. And Brittany, I definitely want to bring you into this conversation. You are a PrEP user, and it's a really cool term. And there are people who are like PrEP for what? Prepare? Okay. So tell us, what is PrEP and why are you using it? Okay.
So PrEP is pre-exposure prophylaxis, and it's a daily pill that you can take, also known as Truvada, in order to decrease the chances that you will contract HIV. And I started taking PrEP because I was dating someone who was HIV positive. This particular person, he was a straight Black man, what we also would term as cisgender, heterosexual Black man, right? And so this person contracted it from having sex with other women. At the time that we started dating, I had mentioned on my dating profiles, on Tinder, on everything, one of my first questions on the first date is, what's your status? When was the last time you got tested? Do you know? Asking those questions, because if I'm dating you, there's a chance that at some point we're going to have sex, right? And I come from a very sex positive standpoint. So I ended up taking it while dating someone who had a suppressed viral load, which means this person typically would not be able to pass on HIV to someone that they're having sex with. But for me, it gave me a sense of comfort of, okay, I'm also doing my part in this. So I'm not just relying on you to take your meds, which is something you are doing. And clearly you're doing it properly because you don't have a large viral load, but this is a pill that I can take every day and I get it for free. So because of my health insurance, and there's also a copay card that's offered by Gilead, which does Truvada. Together, those two things make it where, for me as a graduate student, I don't have to pay anything in order to take this, and I take it just like birth control. For me, it's a part of my overall sort of sexual health regimen.
And I'm so glad you mentioned birth control, and I'm going to pitch this right back to you, Dr. Norris, and then we're going to talk with our third guest. So when we talk about birth control, so I'm not 18, but since I was a young woman around 18, I remember whenever I would go to either a gynecologist appointment, a family practitioner appointment, I was always asked, what is my contraception? And the assumption is I am a woman of childbearing age and that there's the risk of pregnancy. So we would have those conversations about pregnancy prevention options. Do you believe that we should probably include conversations about PrEP in these conversations as well?
Absolutely.
When you look at what's happening, especially with the rates of HIV among Black women.
Absolutely. Just across the board, not just for our community as a whole, but just across the board. As we've seen a shift in primary care and in prevention medicine overall, if you've noticed trends in your doctor's offices, you go in, you're going for a physical or you're going for a pap smear, what have you, they've started asking you about your mental health. Have you felt depressed lately? Have you had any days of sadness? Things of that nature. So this should be something that's as natural as blending mental health questions into just your patient intake on the form, as well as the patient intake conversation of, so how are we here to help you today?
Right.
Things of that nature. Most of those things typically come through advocacy and mandates, and it starts at the local level and then the state level. It typically happens that way before it becomes a federal thing. And so as many advocates get together, it has to have the push behind it, how we advocate for so many other things, because it's just that important.
May I add something to that?
Absolutely.
So I use our university health center on campus, and I literally had to fight to get my Truvada prescription. So I started in the Women's Center, which is where I go to get my testing. We sort of, we do our annual exam as women. I'm having this conversation, and I said, hey, I'm dating someone who's HIV positive. I like this person. I'm going to have sex with this person, right? I'm aware of that. And so for me, how can I protect myself? I know about Truvada. I heard about it from Black gay men. I've also finally seen the first commercial where there's a woman who's talking about taking Truvada, right? So I'm like, what is this? Can I get a prescription for it? And they basically were like, well, we don't really do that. That's not something we do here. And sort of made the conversation. And these are healthcare professionals, right? And so not to throw my school under the bus, but these are people who are supposed to be able to have this conversation with me, and I can go to you and you can give me my prescription. And then I had to go to the one doctor who's the only Black doctor we had on campus at the time, which that's a whole nother conversation, right, around this and around sort of comfort and medical care. And she's the person who works with Black gay men and gay men on campus. And so I was able to have a conversation with her about why I wanted to take it, about being able to take it. And so for me as a consumer and as someone who's going to healthcare professionals, I think it's also destigmatizing how people even understand Truvada. Right. Because now I'm working with healthcare professionals who have these sort of stigma. Like all of this stigma around it, and you won't even help me help myself.
And the other thing too, and I'm gonna sort of pitch to Tima, but a lot of our clinical trials don't really center Black women, and I wanna get back to that conversation. But first, Tim, I would like to ask, we hear so many myths about HIV in the Black male community, and a lot of them are not good. And we hear things about the down low, and that things happen in prison, and that that HIV is actually a curse. For having a same-sex attraction. So I guess the question I would like to start with you on is walk us through the day of a Black gay man in a space where all of that negativity exists?
So that question really depends on, I guess, who you ask, because all Black gay men experience is not the same. You have some people that's really fluent about what's going on, and they try to do all the best steps they can to make sure they're preventing. You have some people who's not educated at all, and they just go on by their everyday lives. I think that, you know, I wouldn't necessarily put in the box because somebody's down low, because somebody's down low, it just means that I don't want to tell my business to someone else. So that's automatic, put them in that down low box. But do that mean they're really down low? That just means I have a privacy about my own life that I don't necessarily have to make it open to everyone. And
Understood.
whoever I choose to have a sexual encounter with, we have that conversation amongst each other. And a lot of times, just because someone's go to jail, that don't necessarily mean they're on a down low either, you know? Everyone who goes to jail that's a man is not having sex with other men in jail. And
That's true.
and that has been out in the community a long time. Oh, they went to jail, they there for a while. Of course, they're gonna have to have sex with another man. That's not necessarily true. I know brothers that went to jail and that came home and they ain't thinking about another man, you know?
Yes.
But it's really up to the person itself. So all this is really adding on more levels of stigma onto people either coming to get tested or either just talking about their sexuality on the whole. I think once we remove labels and all these barriers and say, hey, how are you doing as a human being? What can we do to help you? And wherever you're at in that walk, how can we help you get further in that walk so that you can be able to come back and have a conversation with the people that you come in encounter with and have an open and robust conversation about, hey, this is what's going on in my life and this is how I want to be treated in this process. A lot of times we don't talk about our feelings in the process. We just go through the motions of being in the process with other people, and all the time there's always whatever makes this person happy, I'm going to do it. No, I always tell people you got to fall in love with yourself first. Learn self-love first before you can even try to inject love onto somebody else. And then also learn how to serve from your cup. A lot of people don't understand what that whole cup thing means. When your cup is full, you just got enough to serve yourself. It's in that dish, and that overflow is where you serve people from, and people don't understand that.
So like my cup is like,
It's full.
it's full. It's
For
not
you.
it's not overflowing. It's just
full for you.
Oh, okay.
It's full for you.
And then that salsa that we
Yep.
place our cup on is what we're supposed to serve people from. That means that's an overflow.
Yeah.
Oh.
So you got to have both of those together.
Church,
Yourself
thank
together. Then we talk to other people. It's like, hey, I know where I'm going as a person. These are
Absolutely.
all my sexualities. These are all my sexual things. This is all of who I am.
This is who I am as
This
a
is what-
person. So
yes.
it's like, let's remove all these labels
Let's
and
remove
just
these
take
labels
me
and,
as I
and
am.
take me as I am, but understand this is what comes with me. And know yourself. I always tell people that's the worst thing you could do is get in a relationship with somebody and not know yourself.
Absolutely. You know.
Because you end up following or doing things or putting yourself in risky situations just to be attached or be a part of.
I have a question.
Yes.
For Tim, a follow-up for something that you said. And I agree that people have their own privacy. But in having that own privacy and not having to tell everybody my business if I'm down low or any of the other labels that we kind of use to further marginalize people, don't you have a responsibility to tell the people that you're intimately involved with?
Of course, I think that's what I said to her. Like,
Yeah.
if I'm gonna say, hey, I want to be in a relationship with you. How are you today? Let me tell you about me. This is blah 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 my story, right? And then it's up to her at this time to say, you know what, I want to ride with this or I don't want to ride with this.
Right.
Or you know what, let's be friends and see where this go first.
Right.
You know, honestly, I think that everybody, if you're having sex, it's a 50-50 chance. You got to have that conversation. If they're not starting it, you need to start it.
Right.
And you need to say, listen, I love myself enough to have this conversation with you.
Yes.
And whether I get all the answers I need from you or not, I know how to move in this relationship with you. A lot of times we just, okay, I'm gonna wait till this person asks, and then I'm gonna ask. Then before you know it, you're in the bed, and nobody talked about the condom, nobody talked about anything, you're having sex, and then
We don't
after
talk
that
about a lot
beautiful,
of that
after
stuff
that
in
beautiful love making happen, we sit back with our misery, like, oh my God, I can't believe I just did this. You're in the bathroom, you're looking at yourself, you're washing your face, you're washing your hands, you're like, I just can't
Right.
believe I just slept with this person. I don't even know their first name. It's just a person.
Well, and that this is not something that's limited to Black gay men, right?
Right.
So there are heterosexual men who
Who
have
are
HIV that
HIV
need
positive.
to be
Be
honest
honest
and need to
about
have that
their
conversation
status.
with the person
Yes.
that
Yeah,
they're
but
speaking to. And I also understand that people commit violence against folks who are HIV positive, right? And so we can't say, or we can't expect for folks to be like, I'm just going to be out here loud and proud all
Right.
the time and disclosing my status when there are very real risks associated with that.
Absolutely.
And I'm going to ask you. And so if there's anything that I can get people to take away from me is that you need to ask that question. And if it makes someone uncomfortable, like I tell people all the time, I will go with you. It's in my Tinder profile, it's in my Twitter profile, it's in whatever.
Right.
Like if you're uncomfortable figuring out what your HIV status is, great, let's go together. I'll go with you.
Yes.
Whatever happens, I'm with
Absolutely.
you. I'll take this walk with you, or I'll move through this with you to be a little bit less ableist, right? And so I think that that's important to add to this.
Well,
But
this is, I'm sorry, go ahead. Sir.
But I do really want us to think about this though. It's two in that commitment, right?
Right.
Even if it's just a hookup, it's still just two, or it could be 3 or 4, whatever the case may be. Depends on how you like to hook up, right?
We're not
But-
going to judge people today.
But at
Right.
that same token, we have to be good stewards. If I'm HIV negative, you got to safeguard that negative status. You got to safeguard that. If you're HIV positive, you got to safeguard your positive status, because baby, you can cause me more harm
Yeah.
than I can cause to you.
Absolutely.
At that same token, you got to be invested in your own vessel, and that's yourself. You got to say, you know what, I'm going to stop. As much as I might like you and want to be with you, and I want this to happen right this second, I will look at the bigger picture. Where are we going to be 6 months from now? Am I going to regret that I let this moment take over? And that's what happened. A lot of times we sit in our place and we think about it after the person's gone. We like, oh my God, this happened.
Well, I used to have this thing when I was dating, and I'll kind of like put this out there. I would give my partner 5 questions that he could ask, and he had a week to ask those questions, and then he would lose the 5 questions, and that was kind of to build intimacy. And the questions were pretty innocuous. What's your favorite ice cream flavor? What's your favorite, musical group? And inevitably, I would do the same, and then at one point I would say, what is your HIV status, and when was your last test? And I think that we can, within our spaces, find these little ways to have these conversations. And you're right, if someone is uncomfortable with that, they don't have to be there, but at least you've had the conversation. So we're talking a lot about disclosure. I want to shift this a little bit, and this is for the 3 of you, and this is sort of in my lane. I work in the legislature, so I work with politicians around legislation, and one thing that consistently comes up is criminalization of HIV status, and this idea that if you're HIV positive and you are not telling people and someone gets infected by you, then there should be criminal penalties. And I know it's really contentious in that space, but I want to just take a few minutes, and just really, let's dive into that whole dynamic.
Can I tackle first?
Go for it.
Okay, so here's how I feel about that, and it's going to go back to what I said a little earlier too. So it's still a 50-50 playing field, right? So both of y'all choose to engage in something.
Right.
We must do our due diligence work before we start, right? You can't begin to write a note without having a pen, right? You can't begin to take notes without having paper to write it on. At the same token, you should think of your sexual life that way too. You should say, hey, you know what, I want to engage in this. What is all my risk factors if I'm engaging? I don't really know you from applesauce to apple cider, and I'm going to take all these risks with my own personal body. So I got to be responsible for everything that happens after that, right? And then the person who's positive, you got to know, yes, I truly believe if you're going to sit down and have sex with someone, you need to talk about your sexual status, okay? And give that person all the fair options. And believe me or not, you'll be so surprised how many people are like, you know what, I'm cool with this. I like you as a person, an individual, what I need to do to make sure I'm protected. You have some people that say, you know what, that's not me. I'm good, I checked out. And that's so, and I always tell people, don't let that, because that person checked out, be your stop.
Right.
That just means that wasn't the right person for you.
That's not the person.
And you keep it moving. You find somebody who's going to love you for all your baggage and help you unpack it and get rid of it and make new baggage with them, okay? And if they can't do that, they're not willing to be open and be accepted of everything that's going on in your life, they're just not the right person for you. And I'm just here to say that. This is not the right person. Walk away, let it be. And it's okay. A lot of times we want things so bad, and we end up in all these bad predicaments and situations because we saw what we wanted way before we actually needed or should have it. And that's what draws all this whole sexuality, preparations, all these things. Like, everybody wants everything in a microwave setting, but nobody wants to put the work in before it hits the microwave.
Okay.
We here for
I
a
got a
second
yes
opinion.
and. I'm sitting with this. So it's a yes and for me, right? So one of the things I want to steer us clear from is the idea that people who are engaging in sex want to do it in sort of a committed, monogamous way, right? So I don't want to
Number one.
conflate
Oh, no.
sexual health and advocacy with monogamy, and I don't want anyone to take that away, right? But so part of, for me, I guess, one, I think part of the problem with how we nationally and sort of largely talk about HIV and AIDS is the criminalization. I think the fact that HIV is one of the only things that we criminalize in terms of sexual health is happening, is also driving why so many people are ignorant of HIV. It's also driving, I mean, we can talk about how the US government and our president at the time of the height of the HIV AIDS crisis in the 80s failed us. We can talk about how top down that was an epic failure of epic proportions, right? And that criminalization that comes from that sort of 1980s idea of this is what HIV and AIDS looks like is also driving why so many people who are millennials and who are Gen Z and these young folks don't really know what it means to navigate sexual health around HIV, right? So that there's all of that. And then I guess for me, I also think about for folks who engage in sex work and people who are sort of on the margins of our communities, we're making it even more difficult for those people to get access because now you have to worry about, well, am I going to go to jail because I'm engaging in this thing? That is also how I provide a living for myself, or how I keep a roof over my head, or how I provide for my children and my family. And so
That's really interesting.
we have to think more about that.
So my question to you would be, do you think that just because you're a sex worker, and it could be males or females, it doesn't really matter, or heterosexual, that if you are HIV positive and that's your way of making your money, then it's okay?
I don't know if it's a matter of being okay. I think disclosure is a matter of sort of negotiation, right? And so it's, do I feel safe enough to disclose my status in this moment? I don't ever want, and I don't ever want us to get to a place where we feel like we're legally forcing people to say before they can engage in intercourse if they have HIV that they must tell someone.
So do you think it's I'm going to pick it back and play the devil advocate. So do you think it's fair to the person who is HIV negative and they choose to engage with you thinking everything is okay?
I am HIV negative. I am choosing to engage with people, right? And
but on the backside of it, are you saying, okay, I'm HIV positive, and you saying I'm negative and I'll choose to engage with, that's because you choose to engage with a person, right?
But you don't know.
But if I'm going into a relationship, let's say I'm going into not a relationship, I'm going into if I'm going to be a John, okay?
Okay.
Right.
And I'm going to go out here and I'm going to buy this girl. I don't, honestly, as most Johns, I don't expect you to tell them the truth. They there for one thing.
Sure, the
right?
fantasy.
But on the same token, if you know that, two things. I think here's where the part come in at. If you know you're HIV positive and you're not doing nothing about it, that's when I believe that you should be held criminal liable for it.
Okay,
now,
so,
if you're HIV,
right,
one second.
right,
If you're HIV positive and you on your medication, you get into viral suppression, you're doing your doctor's thing, you're doing all the steps. I don't think there's no one should bring you to court saying that, oh, just because you're HIV positive.
I want to pull Dr. Norris in here. I want you to finish that point, but I want to pull Dr. Norris in here on that because you're over there squirming like I got words.
No, actually, that's not. I find this extremely educational and intriguing. Along the criminalization lines, what we see on our side, on the prevention and treatment side, is that this is why people don't want to know their status. Because if I know, then now I'm responsible for all these other lives that I could potentially affect and then go to jail. And once I do know my status, I still can be criminalized. And so the stigma of, if I tell you, or are you going to blame it on me when it could have been all these people who've been sharing you?
Yes.
And so that's a risk as well.
Right.
People aren't always just me and Tim and we're together. It could be me, Tim, and Brittany, and we all having a good time.
Right.
And if both of them are positive and I'm negative, then, but I just want to focus on Tim because he's the man, and this is black man's fault.
Exactly. Which
Then
is
we're
not
buying
right either.
into this whole system that's been created to help us to continue to criminalize a certain element of the population and to further exacerbate the epidemic that's already here, that's prevalent in the South, that is problematic in Atlanta, with some of our zip codes being compared to countries in Africa
Absolutely.
in regards to the prevalence of HIV. And then with the young people, that's something that Brittany specifically spoke to with the younger generations. It's not even that it's on their mind or on their radar. Right now they're having a good time. Some of them have heard about it, but there's this invincible attitude. And I've been in groups with HIV persons who are in care and out of care. And those who were out of care specifically said, I mean, they just take like one pill a day anyway. And so it's just whatever. And like, I'm strong, I'm healthy, I feel this way. I don't have to be in care. And so when we think about how we're portraying everything, they're not afraid of contracting it at all.
Right.
Because they're thinking it's a Flintstone vitamin that they take. Oh, if I get it, then
We've
it's just
made
one
it so
pill a day.
easy. We made it like the common code.
And so exactly, and so you have
Yeah.
this push and pull, and people are inundated with information that is
Right.
confusing. We need a message that is clear. We need messages that are strategically targeted and tailored towards certain populations.
Absolutely.
Because how you're going to do it for young folks and how you're going to do it for the growing, aging adults who are over 60 who thought, oh, I'm not going to get it.
I wanted to talk
And
about
they
that.
are skyrocketing and surpassing everyone else, even in nursing homes,
Absolutely.
where they're sharing partners as well. I mean, you're in a nursing home, you know, Mr. John around the corner, it's like 4 of y'all ladies in there,
That's right.
and you're not like, oh, you know, Mr. John, you know,
I'm
push your
Tuesday,
oxygen
that's
tank
all
to
I
the
know.
side, you know, what's your
Whatever
HIV
happens
status?
on Wednesday and
Y'all
Thursday,
are-
I don't know.
It is going down
On
in nursing
Tuesday.
home facilities, and that's a segment of the population that we're, so what you gonna do? You gonna lock Mr. John with his oxygen tank up?
Yeah.
Because he didn't know, and now
Right.
4 women in a nursing facility now have it?
I always tell people, you cannot blame the last person that you had sex with and think that's because they have it, then guess who you got it from. Because a lot of times people come, I have had people truck people into my office numerous of times, like this is a person, this is a person, this is a person, and they end up heartbroken because they can't find the person who they think it was. And then you left with all the memories. And I told them, listen, baby, it's time to move on. Like, you got to deal with what's going on with you right now. Finding the person that gave it to you is not going to solve the issue. Like, you need to think of more like, okay, how am I going to stay healthy? What am I going to do? What does this look like for me over 10, 20? And I tell people to think longevity about this thing. Like, don't think, okay, I'm going to just take this and everything's going to be over with tomorrow, because it's not. Now, the criminalization part of it, if a person don't know that they're HIV positive and they're having sex, I don't think we should be trying to criminalize these people and lock them up. They don't know. But if you knowingly have HIV and you're not going to the doctor, you're not trying to reach viral load suppression, you're not doing anything about it, then I think that you should be held to some type of something. I don't know if it's mean lock the person up or throw away the key, but I think that at some time we have the entrance to say, hey, what are you doing on your behalf to make sure that you stop this from going around? Or do we just let the person just run wild and free, do what you want to do, nobody says nothing?
So I want to sort of shift gears a little bit, and I want to talk about sort of the history, okay? And I'm going to just throw this out to the panel. Brittany, you mentioned the 80s, and you mentioned it with some nostalgia, and I was shook a little bit. I'm like, wait a minute, I was there in the 80s. The 80s was a fun decade. But I recall in 1984, when this whole conversation started. I remember when they called it the gay plague. I remember when Reagan didn't mention it, when it was gay men in New York and San Francisco. It was almost bi-coastal. When the epidemiologist from the CDC pointed patient 0 was a flight attendant from, I believe, Montreal. So I remember all of that. But one of the things that I want to ask the panel is, it's been 30 years. 30 years. Why haven't we gotten on top of this epidemic?
2 things. One, we have not adequately defined risk. We have not changed the face of risk along with defining it. So if I'm not thinking that I'm at risk, I'm continuously ignoring your commercials, your ads, when you're talking to me or I'm hearing conversations like this, oh, this doesn't apply to me, so I'm just swiping and keep going, or what have you. And then the second thing is personal responsibility. We are so in this mode of, oh, it's on them to tell me, not it's on me to protect myself. That is huge. It is huge when I sit and I talk with my girlfriends and we're talking about this very subject. and they want to point fingers and he this and he that, or she this and she that, and all of these things. But at the end of the day, it is your body, it is your temple, it is your responsibility to protect yourself. And I, even as a health professional, 20 years in the game, had a shift in my own mindset about my responsibility and my personal health when my health status changed. And then I became immunocompromised through an autoimmune disease, which makes me open to everything. And that shift and that personal responsibility, to me, I'm of the mindset that you spoke about in Botswana. Everybody's positive. And that's how I approach it. Everybody's positive. Because you have so many people who still live with stigma, who aren't going to tell the truth, or who aren't willing to go with you to get tested and say, okay, we're going to show each other our results type thing. And so when I'm not taking care of my temple and I'm not assessing myself as being at risk just for being, not because I'm Black, not because I'm a woman, not because I live in the South, but just because I'm a sexual being who likes and enjoys sex. We start there with defining risk, redefining what risk looks like, and showing that and illustrating that, and then really honing in on personal accountability.
I mean, my sort of immediate visceral answer to that question is because the rising cases of HIV are Black people, and we exist in a country that is inherently anti-Black at its core. There is no reason for us to seriously engage HIV as a crisis anymore. So, and I was born in 1990, right? So my context for the 80s is through my parents, through the media, through all of these other things, right? I'm only 28, right?
You're fine. You're fine.
And so I feel like part of the shift was after that, sort of initially when we were talking about HIV/AIDS, and I look at the history of it from my own research, the face of that was white gay men.
Absolutely.
When that changed, I feel like the amount of money, the amount of advocacy, the ways in which we care about it also shifted. I understand that until the entrance convergence of the HIV epidemic becomes in the best interest of the white community again, I don't personally foresee
That shift
that
is
we
happening.
are going to care.
That shift
So
is
you do see HIV as a social justice issue.
Absolutely.
All right. Yes.
So I think it comes back to us as humans.
Okay.
I think that we're, until we change our sexual appetites and our sexual beings and how we have sex and who we engage in sex with, it's never going to change. Because, and then secondly, testing. Like, I always tell people, even if you have sex one time, that's all it takes. It's like pregnancy. You can get popped one time. It could be the girl. It could be the girl who went out and had 700 guys and never had a pregnant. The girl who got one time and bam, she popped, and she's like, why me? Baby, it doesn't have a face. It doesn't have a name. It doesn't have nothing. And until we think of it differently about who we encounter, how we encounter, and having these truly in-depth conversations with the people that we choose to encounter, even if it's off a Jack, Grinder, Twist, whatever, you still need to say, hey, what's going on with you sexually, baby? Because I want to be in contact. I want to have these type of relationships with you, but I want to know how to engage with you. And if you are positive, I know a whole bunch of ways to engage with you still. And if you're negative, boom, babe, we can do this way. But let's start opening these lines of communications up so that we can get to that point. And that's the only way we're going to be able to get in front of HIV is three things rather. Testing is one, because everyone who's tested, we will know your status. The people who are positive, get them to antiretroviral drugs to get them down to undetectable, right? And the people who is lost to care, they are our worst enemies. And I'm not saying this in a bad way. They are the enemy of the state, if you think about it, because they out there, viral loads could be very, very high. We don't know what's going on. We don't know who they are.
But is that enemy of the state, or is it that there's other determinants that might be playing into?
Well, either way you slice that bread,
okay.
And I'm not saying it in a bad way. That's why I say I'm not saying it in a bad way, because them not knowing, or either them knowing and not in care, you still perpetuating this because you still having sex.
I feel like some of this also goes back to, so for one, we exist in a hookup culture, right? Particularly for younger folks. And so and I say this, me being a millennial, right? So we're a much more sex positive generation than people before us. I, focus on college students. My work is around college students and the experiences on college campuses. That's my research agenda, right? And so I know that students are engaging in more sexual intercourse than ever before. They're more open about it, and that folks are sort of doing this on their own terms. That's great. And we don't have sort of the language and the conversations that we need to have around HIV and AIDS in order for folks who are engaging in hookup culture to understand that there are direct connections between the fact that once I've had sex with you, I've also had sex with everybody you had sex with. Right, so not like I physically engaged with them, but because I've been with you,
I assume that risk.
I'm assuming the risk of everyone else that you've been with. And by not getting tested, by not knowing your risk, by assuming, oh, I'm young, I'm 21, I'm on a college campus, it's fine, everybody's good here, we're now perpetuating the idea that, oh, because someone looks good, or, you know, the sort of vision and conversation that we have sort of in the larger national scheme around what HIV looks like is not what HIV is anymore.
Absolutely.
And because that language hasn't shifted, we have a disconnect. So for me, I feel like the big piece is breaking down that disconnect.
So do you think that college students, or shifting gears for a second, do you think college students are testing and talking about it more now?
There was a study.
I haven't been in college in years. I don't even know what's happening. I go to college campuses and I feel like somebody's mother coming to like deliver a care package. It's that kind of situation.
I mean, so here's the thing, right? So some of the more recent studies said something around 2 in 5 students, you know, speak openly and honestly and engage in sort of testing around HIV. 2 in 5. So that leaves 3 other people out here in this group of 5 that's not talking about it, that's not engaging in it, that's not getting tested. And so those visible campaigns around get tested, get answers, sort of that stuff helps, like knowing someone. So for me, if I can do anything, if I can become the sort of black heterosexual woman face of PrEP, I don't even care. Like, fine, make me that, put my picture everywhere, slap it on a billboard. I'm fine with that.
There are people who can make that happen. Be careful with that.
That's fair. But I have people, you know, I did a Twitter thread on World AIDS Day, and I had college students coming to me in my Instagram DMs who were saying, okay, what is this drug you're talking about? What is happening here? Can you tell me a little bit more about this, right? And so until we shift that 2 in 5 number amongst college students, I think we're going to continue to exacerbate the number of new infections and the number of cases where folks are infected and don't necessarily know.
Okay, so we have college students. I mean, I'm going to sort of throw it out there. We probably have a couple of millennials, X, I'm assuming Generation X. Is it the same conversation for everybody?
No.
So
Absolutely
tell me, I'm starting to, for some reason, find myself in these situations, in these kind of groups of like the over 45 divorced crew. And that kind of extends from 45 to maybe 60, you know, and everyone's back on the prowl again. And everyone, you know, they divorced and their kids are all gone away, and now they're at, you know, LA Fitness or wherever they're going to work out, and, you know, they go to H&M and get an outfit. And so now they're back on the prowl. A lot of these men and women have been in 20, 30-year marriages where, for the most part, it's been monogamous.
This is what risk looks like.
Absolutely.
This is what new dating looks like, because it's not the same. If you've been off the market 20, 30 years, it's totally different out here now. And shifting to that, a lot of the hookup culture, which Brittany referred to, it's happening and it's real. And part of our shyness about sex and people who don't see it in a positive light and who can't talk about it up front. They know that they want it. They know they want to look like it. They know they want to just put the whole snack out there for everybody to get a little taste.
The whole snack.
So when you think about that and you think about how you're presenting yourself and having these conversations with men, and I'm having these conversations, it's so difficult because they're like, I don't like men. So they don't see themselves at risk. So this is why I talk about find the face, redefine what risk looks like, because these are real conversations with real friends of mine who are in that category. Fine black men, professional, doing really well for themselves, dating younger black women who are in their 20s, who are dating all kinds of folks and having a good time, and they're not thinking beyond themselves and their sexuality and who else she's dealing with, because she never said you guys were monogamous. And so I'm not looking at risk. I'm looking at the fact that I was able to pull her. I got it going on. And
the concern is not getting her pregnant.
No.
For most of them, it's like
That's the biggest thing.
It's
You
like,
know,
no.
she's not pregnant and, you know, walking around not really concerned about any STD, let alone, I don't like condoms. I never used them in a 30-year marriage. Now I have to use them. Oh, I'm irritated. Oh, it just doesn't feel right. It doesn't feel the
Yes.
same. So there are so many layers of that when you've had a stream of conscious behavior in a, let's call it, monogamish relationship for so long, and now you're out and about and you got all these people trying to holler at you. You know, and you're impressed with yourself on what you can pull.
my mama says smelling yourself.
Yeah, all of
Smelling
that.
yourself.
Well, and you came up when this stuff wasn't as prevalent.
That's important.
You heard, yeah.
You heard about it, but you probably
and
were
it
married.
didn't
You
apply.
got married.
Yep.
And even if you've seen cases in your own circle, it's been those people.
They look a certain way. They're not.
They look a certain way.
I don't deal with those people.
They engage in certain behaviors that I don't, you know, delve into. And I don't see myself at risk. So if I don't see myself at risk, then how am I going to behave as a person who doesn't believe in
So
risk?
it goes back to that whole idea that you're saying, Dr. Norris, that we have to define what risk looks like. We need to move beyond just, you know, young black women or young MSM or men who have sex with men when we're talking about HIV risk, and that we have to now have a new face. And that new face might be your dad, your pastor, your doctor, you know, the guy who, that elected official that's now single and back on the market, the guy that you looked at or the woman that you looked at, and to say, okay, yeah, they're at risk too.
So risk, and I love that you keep calling this risk thing, because that's what we got to rephrase. We got to rephrase risk and also what prevention looks like too.
Yeah.
And then we also need to think about the people at risk. So when we think about at-risk populations, and we always throw this MSM, men who having sex with men, and they throw that up there so much, it's all them, it's all them, it's all them. But just think about it, if we only testing in that one segment of community,
Absolutely.
of course the rates are going to be higher because we only testing there. So for instance, the change has shifted a little bit to test more in Latinos community. Now the numbers in Latino communities going up because you know what? We're focusing resources there.
Right.
When you focus resources, you do more testing in certain community populations, the numbers are going to be higher. So the whole thing with, let's say, for instance, backtrack just a second, PrEP, for instance. People's like, oh my God, PrEP is the best thing to do. People start taking it, and now the chlamydia and gonorrhea rates are off the charts. You know why? Because people are getting tested more for chlamydia and gonorrhea now. So that's the reason why. It's not like they're having more sex or less sex. They're having the same amount of sex they was having before they even took the pill. It's just now they're doing more routine checks. So they're getting checked more often, and their status are coming back quicker, so they understand what's going on, and they're able to get the treatment they need. But in that same token, while that fire is burning, there's somebody on top of them just pouring fuel, just keep pouring the fuel like this. And that person that's doing this is the person that holds the resources to the funding that's actually going to get people to prevention and treatment. And then also, when the money come down, the way these contracts are written, they're written so crazy you can't even do nothing with the money. It's like you're looking at the money like, okay, I can't really be true to the community I'm serving because the grant doesn't allow you to service them in their capacity. You understand what I'm saying?
Absolutely.
So I can't serve you as a black heterosexual woman the same way I would serve a black gay man or the same way I would serve a Latino man, because all those are different types of services.
Because the funder says that it has to be this population.
It has to be either this population, it has to, and then you only can do but this certain things. So I know, for instance, to reach black gay men, you throw an event together, you have some drinks, you have some food, you bring together, they will come to that conversation and talk to you all day. You just say, put you in the room and let's have a conversation. You might get 10 people that show up.
You got to go where they are. And, you know, maybe with the black gay male population, that's a place to meet them. Maybe we have a testing at a church, at a synagogue. So we're meeting that population that don't believe they're at risk. Or maybe we take it right down to the government building and say, okay, guess what, everybody? The entire city council has to be tested. The entire board of commissioners come and get tested, and you start showing that it's you start normalizing
the situation.
You start redefining what risk looks like.
And so some states are doing that in that they have started doing what's called opt-out testing. So instead of you having to go in and ask for the
have to
HIV
opt
test,
out.
whenever you're in for any medical services in certain facilities, you can opt out of the testing. Otherwise, everybody gets tested. And that's a way of having people to know their status. That's a way of starting them in care and getting them immediately to the resources that are needed, because people recognize you shouldn't just be sitting in certain neighborhoods and then just targeting, specific groups, because you're doing the us and them type thing, that everyone has a risk of some
So let's play devil's advocate with some of that legislation, because I'm familiar with it. Insurance companies, they flag multiple tests as risk. So there is this concern that if you're proactively testing people, that when that pops up on an insurance application, they're looking, oh wow, why was this person tested for HIV twice a year for the last 5 years? What is their risk? What are they doing? Is that going to sort of trigger higher premiums or a decline of coverage? The other thing too, those tests are not confidential, and they actually hit your medical records. And we do have this ugly, and guys, you are the experts, chime in this, but you do have this history of discrimination based on either, or based on what's inside of your medical records. So I just kind of want to, I like that, but I want to throw that back out to you guys. How do we feel about an opt-out? How do we feel about that?
I personally, two things. So I like the fact that you're giving people options, because when people have options, they feel like, okay, I'm empowered in my choices, right? But the same token, it's something as so detrimental to people as HIV. As I believe that a part of a routine when you go into a hospital, that's just a given. Like, we're going to collect your cholesterol, we're going to check this, we're going to check that, we're going to check chlamydia, gonorrhea, syphilis. We're going to do all these panels, because we're taking care of the whole body. We're not just taking care of one sector of your body, right? So until we start thinking like that and getting doctors and getting public health officials and everybody to think that way, we need to take care of the body, the whole entire body. And whatever that makes it sound, you may come in here and say your throat hurting, but baby, we're gonna check everything just to make sure that some other thing is not the reason why your throat's hurting, okay? People come in and think that all the time, like, oh, I'm just here because my throat is hurting. I'm like, okay, well, what's really going on? Do you want me to write you a prescription for some medicine? Well, let's check and see. You could have a chlamydia in the throat or gonorrhea in the throat. You know what I'm saying? There's all these different things that can happen. You may think it's a common cold, and it's not, because they opt out of those testing, And same thing with my job. Like, people can opt out. You don't necessarily have to take an HIV test, but then when I see people opt out, I'll go have a conversation with them, and I'll explain to them the reason why, and I'll explain to them where we at and what this means, based on your race. Like, what did this mean to you? And then when you start having those in-depth conversations with people, they'll be like, you know what, you're right, and I have been doing this, and this has happened, and they start open up a whole can of worms. But we allow them just to opt out with no repercussions of them opting out, or no one's having a conversation of them. Okay, I understand you're opting out, but why are you opting out?
So as far as that policy, I guess it's, we kind of all believe that, it has some merits, and then it has some things that we need to be concerned about when we implement it.
So I'm in favor of opt-out because I work with college students. So you're talking about people who are on particularly for residential campuses, folks who are within a specific construct, who are running into each other within the same spaces. You see each other on campus all the time. You're sort of within this targeted demographic. If you were to say at every university in Georgia, every time a student goes to the health center, we are also going to include HIV testing in there, we can help to sort of get people who need to be in care. We can help to sort of track and maybe become aware of like how students are engaging in sexual practices, so that we can do some more educational campaigns, so that some of that is passive campaigns, right? It's not always having someone in your face talking about what HIV is. Sometimes it's seeing a poster with one of your classmates. You're like, ooh, what's that? And then it's your classmate who's saying, hey, I'm Brittany. I get tested for HIV every 3 months because I engage in heterosexual sex with men. I often sleep with black men. I understand as a population as a whole, we're at a higher risk. I also take Truvada. You can get a prescription for Truvada too. Ask me about it if you see me on campus, right? And so there are ways in which colleges and universities and sort of public health professionals who engage college and university campuses can help to shift the conversations around HIV testing, around who needs HIV testing, about sort of even the purpose of HIV testing as a whole.
How do we talk about condom negotiation? How do we talk about negotiating things like, PrEP but condoms? How do we talk about condoms?
This is it's so hard because this is such a personal thing, right? So for me as someone, I'm an ENTJ on the Myers-Briggs. I really don't care about people's feelings sometimes in most contexts, right? Especially outside of work, I really don't care. So if I'm having sex with a man, I'm gonna just be like, yo, you putting this on, safe sex is great sex, better wear latex. Lil Wayne taught us that, right? So
Yes,
in
he
the
did.
context of that song, his focus was on pregnancy. I ain't getting pregnant because I'm controlling my body, and we just not doing that.
Okay.
And I have control over that. And using a condom in conjunction with the fact that I'm on PrEP means that I'm also not contracting HIV from you, because I'm saying you're either going to use this or we just not going to do this. I can call
Right.
any number of people in my cell phone to have sex with me, but I chose to have sex
Oh.
with you. So if you want to do this with me, these are the terms and conditions in which you need to abide by. Now, I can say that I'm a graduate student, I'm almost 30. I understand that there's a way in which I understand agency as a Black feminist. That's not as easy for an 18-year-old, even me,
Absolutely.
to have said that. That's not as easy for an 18-year-old college woman to say that. So I feel like part of what we need to talk about in condom negotiation is even creating sort of some baseline language that women can start saying when they're having sex with male partners. This is a way that you can do this. I don't necessarily have all the answers for that, right? Because my sort of Southwest Atlanta, like, immediate way that I'm gonna say that is, you gonna do it or you're not gonna do it, or we ain't gonna do this, right? That's just who I am and how I show up. But a lot of people are a little bit more timid. We talked about sort of people being, anxious around having conversations around sex. If there's anything that women can take away from this, is you need to learn how to say no. If you're uncomfortable saying no, telling someone, look, I tell people, just tell the story. I have a friend, it doesn't have to be your actual friend, who was recently, who recently found out they were diagnosed with HIV. That's made me a little bit more conscious and aware of my own health. I'm not comfortable having sex right now without a condom. Now, that friend may not even actually exist. This could be a friend from cyberspace, it could be a friend from wherever. But
Right.
making it where you're putting this off of you,
And
if
on
you're
some-
uncomfortable having that conversation, and
Right.
onto the larger conversation, I think
Awesome.
can help college women. Because then it's, oh, I'm so sorry. All right, yeah, fine.
Awesome. So one follow-up to that, and then we are going to have to close. What about women who are on birth control? What about women who are on the IUD or the shot or long-term acting birth control? How do you negotiate condom use in that space when it's clearly not about pregnancy prevention?
Yeah.
In 30 seconds.
By explaining to people that condoms are not solely for the purposes of preventing pregnancy. They are also for minimizing the risk associated with transmission of sexually transmitted diseases and infections and HIV/AIDS. So you need to wear a condom every time that you have sex, no matter whom you're having sex with, even if you're married to this person, because they could be having sex with someone else, in order to prevent yourself from contracting an STI.
It's okay for women to carry female condoms.
That's
Yes.
what,
Have
that's
them
what I was
for
going to go to.
themselves.
Yes.
Let's not put this all on these.
Yes.
You need to do this for me.
Okay.
I'm doing this
This
for
for
me, and
myself.
this is how it's going to go down. Or again, it's not going down at all. So we don't want to always put everything off on the other person. We need
Absolutely.
to empower women to do more with female condoms as well.
You guys are taking it right out of my head, and thank you. Because that's important. And we don't talk about female condoms enough, and I think we need to, as part of that conversation, possibly start involving female condoms in that conversation. What would be your takeaway for today, Dr. Norris?
My takeaway would be that personal responsibility is the biggest thing. I don't look for other people to pay my bills and I'll sit in the house and take care of me. I don't look for other people to wash the car if my car is dirty. So why am I looking for someone else to take care of my body, my personal space, my valued space that I know you want and that I know you're going to enjoy all the tricks of the trade? So let me protect that in everything that comes with it,
Well.
with everything that's in me.
I'll sip to that.
All right. I'll sip to that too. All right, Brittany?
My biggest sort of piece of advice or takeaway from this conversation is getting more women, particularly younger women, to understand that HIV is not a gay man's disease. That is my sort of soapbox moment. Like, you need to understand that you can contract HIV from a heterosexual man who has only had sex with other women. This is not something that involves, people being on the down low. This is not something that is limited to queer communities. And so it's on us as women to become more educated around what ways we can prevent contracting HIV. And for me, that is both condoms and Truvada, which is PrEP.
Okay. And
My takeaway from this will be know yourself first. Learn and love yourself so much that you can see all the madness coming to you. And once you know self, nothing else can penetrate that. Like, if you really deeply pour into yourself and find out who you are, like really deeply find out who you are, your life will become so much easier because you can see and you can understand and you can hear. And we can do all those things together. You make better choices. Like on a whole, you just do. You make better choices because you know who you are and you know your own values and you know where you stand.
Thank you. Well, my takeaway is that this was amazing. It's been over 30 years since we started having this conversation around HIV and AIDS, and we're still having it, and the conversation is shifting, and I thank you all for being here today to kind of let us know what the shift looks like. Thank you so much.
Thank you.
Thank you.
Thank you.